Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist who has been in practice for 40 years in the Houston area. This is a special presentation on your heart health. In this presentation, we're going to focus upon healthy diet regimen, which I would like to call it as principles, or more importantly, concepts. What are the things that you need to keep in mind when you choose a particular group of foods, and how much do you eat, and what are the things you need to avoid, which most of you already know what it should be, but I'm going to give you some basic concepts. So one, you can, using these particular principles, reduce your weight, keep your calorie intake to minimum, get on an exercise program, and reduce your cardiovascular risk factors and enjoy your life. So let us begin with the feature presentation. Basically, they recommend anywhere from 2,500 to 3,000 calories of food for an adult. That was based on people who worked in the farms 12 hours a day, sweating and toiling. But most of us today sit in front of the dual monitor computers and romance these electronic or LED screens for 8 to 12 hours a day, and the type of work we do is totally drastically different from that. So using the concepts that were based on hard working labor population absolutely doesn't apply to an IT technician, IT professional, most of us are IT. Even as a doctor, I am like an IT person because 8 hours of the time I'm sitting in front of the computer, completing the charts, looking at the lab tests, reviewing the x-rays, you name it. Anyway, so the first concept I will tell you as far as the total calorie intake is concerned is how much does a body need, a minimum calories, in order to make sure that you can sustain normal bodily functions and still be able to maintain your muscle mass. Remember now, muscle mass, that's the key point. When you start breaking down your muscle, that's called the catabolic state. That means you're destroying your body and your muscles and strength. That's not what we want to accomplish. In order to maintain protein mass intact, the muscle, you need at least 12 to 1300 calories of food intake. So let me be a little bit generous. I would say keep your calorie intake to between 13 and 1500 calories per day. Please write this down. Put this on a yellow notepad, and these are some of the points I'm going to tell you. Just put them down and put them on the refrigerator door and try to practice that on a daily basis. That is the step number one. Your calorie intake should be no more than 1500 calories per day. Unless you are involved in a very physically demanding exercise, like you're using a jackhammer for 8 hours on the side of a freeway, that's a different story. But for the most part, those who are doing sedentary work, you can get away with 1500 calories of diet. That means you can cut down almost 40% of the calories that you're eating right now and still feel better actually than what you were before when you were picking out on those 2,500 to 3,000 calories. So that is the first concept which I want to drill in you, and that is by reducing your calorie intake by 30 to 40%, immediately within days you begin to see your weight starting to come down. The second point I would like to make is to do with the carbohydrates. Carbohydrates are the biggest culprits in the adult diet, much more so than protein and fat, cholesterol, butter, cheese, all these. Why? Because carbohydrates, when they get into the body, they can be converted into protein, they can be converted into fat, they can be converted into cholesterol. So, what happens? The body has a limited amount of reserve space for carbohydrates. That is, it is stored as glycogen in the muscles and in the liver. It is like an immediate fuel, like a rocket hydrogen jet fuel for the first 3 to 5 minutes for the rocket to get into the orbit and be maintained in the orbit. So that's the kind of energy the carbohydrates provide. You want to run immediately, then the muscles use glycogen. But your human heart beats from the first time it beats to until you take the last breath, or maybe even until the last heartbeat. So, what do we need to do? We need to burn fat and reduce carbohydrate intake. So, I would say, here it says 500 grams of carbohydrates. If you continue this kind of diet, you will never lose weight. In fact, you continue to gain weight progressively over a period of time, because as we get older and older, we do less and less exercise, and all of this is going to build up as an unlimited source of fat. I told you there's only 700 grams of glycogen the body can store, whereas the body can store like 75 to 200 pounds of fat. You get the picture. So any carbohydrate that is not needed to fill up the tank in the glycogen storage is going to go into the fat. So what you need to do is cut off all this fat buildup by minimizing the glucose intake to what is minimal needed. And when you do that, not only are you going to lose weight, you're also going to maintain your blood sugar level better, and your insulin requirements are going to come down. As a result, your insulin resistance gets better when you cut down your total carbohydrates. So the second point I want to emphasize is keep your carbohydrate intake to less than 100 grams per day. Yes, it can be done. The way you do is you replace one of your diet with salad and a grilled meat, be it a grilled fish, grilled chicken breast, or even a grilled lamb, whatever you want. In that meal, your carbohydrates are down to like 10, 15, 20 grams. So if you do one meal with salad and meat, or you can just use beans if you don't eat meat. Like there are a lot of beans, legumes which have proteins. So you can get your protein from that direction. The second point is the carbohydrate intake, which should be less than 100 grams per day. Number 3, protein. Your protein intake should be less than 8 ounces per day. So if you buy a pound of meat, you shouldn't be finishing that for dinner. I know there's a 24-ounce Del Monte steak with butter and steak sauce and a truckload of French fries. All of them put together probably 5,000 calories, and you can sit in front of your friends and boast yourself as how you can eat the whole thing in 30 minutes. Yeah, but your friends are not going to be there when you're in the intensive care unit with a heart attack. That's the different story altogether. So protein intake should be less than 8 ounces per day. Maybe you can divide that 4 ounces for lunch and 4 ounces for dinner. Maybe you can get an extra ounce in the morning if you want through eggs. All right. So that is as far as proteins are concerned. As far as fats are something that you really need to just minimize on a daily basis. Anything that is visible fat, like white fat on a meat, must be trimmed altogether, or a yellow fat on a chicken. They come in all different colors and shapes and sizes. Just trim all the extra fat. You don't need it. The fat does not add any flavor, taste to your food. Only fried foods, the carbohydrates taste good, but if you try to drink that oil, you're going to throw up. So oil does not add any flavor or taste. It just makes things crispier, and that's the thing. But I would eliminate all those extra fat calories. I mean, here they say 60 grams of, where is this total fat? 30 grams. That's not a whole lot. Anyway, the next thing is salt. If you have any history of heart failure, you need to watch your salt. Never take a canned food without looking at salt. If it says more than 300 milligrams, you better keep it on the side, because salt intake can have a profound effect on the symptoms of your heart failure. Okay, we talked about the carbohydrates, we talked about the proteins, we talked about the fat. All of this, you know what needs to be done, but I'm just giving you the basic concepts of how to streamline your diet and lifestyle. I'm talking about lifestyle modifications, adaptations for the good. Okay, here are a list of some good carbohydrates and bad carbohydrates, sodas and starches, white flour, and I don't even know what is this. Oreos, cookies, pastries. I mean, they are all bad because they are high in processed flour, they are high in sugar, and they also have high quantities of fat. Maybe not the sodas. But what I would say is you can select any one of these carbohydrates. As far as I'm concerned, it doesn't matter as long as the quantity is limited. I mean, I have done a whole different video on good, bad, and ugly carbohydrates. You can watch them for little more detailed information about the carbohydrates that you need to choose, which have a lower glycemic index. But you can combine these with salad and bring down the glycemic index. The main thing is you select whatever favorite carbohydrates you are used to. For me, it is rice and chapati. For you, it may be pasta or it may be noodles. Make sure you don't get more than 100 grams per day. I mean, that's the bottom line. Next, meat. If you like meat, that's a great source of protein, but you can get proteins from a variety of sources besides meat, like these nuts. They have not only protein, they also have good omega-3 fatty acids and polyunsaturated fatty acids, which are good to lower the cholesterol. Egg is an excellent source, but it does have high cholesterol, like 274 milligrams of cholesterol per egg. But you can replace with these nuts and also beans, which are a great source of protein, fiber, and also some carbohydrates. So I would say select fish, which is generally lean, or if you select meat, which is fine, make sure it is lean meat or a ground meat which has not 50% fat. I mean, that is horrible. You are basically just eating fat. Okay, next, oils. When you select oils, I have been using olive oil for decades now. So I would say select an oil that is rich in poly and mono unsaturated fatty acids. Don't select oil which is solid at room temperature. Some of them are hydrogenated, they may have trans fatty acids, and they are the worst kind you can use in any type of cooking or preparation. So I would just say use vegetable oils or olive oil, which is probably one of the best ones, and there are other ones also, but I use olive oil. So that is as far as the oils are concerned. Of course, people want to know, Doc, how about a glass of wine or a glass of whiskey? I think it's okay with me as long as you're having one. The American Heart Association says maybe you can have 1 or 2 glasses of drink. I would say just have 1 glass of wine. A red wine is supposed to be more protective according to the French study. Whether you like white or red wine, it doesn't matter to me. Just have a glass of wine and just enjoy the company. You're there to enjoy the ambience. You're there to enjoy the person with whom you're having a conversation. You're there to enjoy the evening. I mean, that is more focus. That should be the more focus than trying to see who can finish the bottle first. I'm not talking to that population. I mean, I'm talking to them if they want to hear me, but I'm more focused on people who are serious about getting their lives in the right path for a heart healthy lifestyle. And there's my book there, Heart Healthy Lifestyle. You can see, you can get a copy of that from Amazon. So as that's drinks, whether it's beer, wine, or a hard liquor, try to restrict it to one drinks and just sip on it like it's like it's honey. You just one drop, keep it down. One drop, keep it down. You can have the same glass till the end of the evening. As I said, you're not going there to get drunk. You can do that at home for like 10 cents on the dollar. So why the hell do you have to go there and get drunk and start throwing up and people will throw you out? You don't want that one. Okay, I mean, here are some healthy snacks. Fruits are a great source, and nuts, again, I told you, they have protein, they have polyunsaturated and monounsaturated fatty acids. They also have some fat, but that will help to, get you some protein. It will help you get some nutrition. It will also have minerals and vitamins. So they are a great source. An apple is... you heard that an apple a day keeps the doctor away. Well, what if you're a doctor yourself? You still need to stay healthy. So there's nuts and all these different things like berries. These are some things that can help you to time between meals. Really, you don't need a whole lot of stuff between meals because you want to constantly keep your body kind of in a status where you're burning your fat. You want to turn your body into a fat burning machine, because if you're not burning fat, you're not going to lose weight. When body burns fat, it releases lipoprotein lipase, and that helps to burn the fat. It also releases endorphins, which give you a sense of high, a sense of accomplishment, which will last for several hours. The lipoprotein lipase that is released continues to work long after you even stop your exercise. And that's the good thing, because when you exercise, the body releases lipoprotein lipase to mobilize the fat to provide the energy. Do you know the eagles flying at 30,000 square feet in the sky and the human heart, which beats forever, they all use fatty acids for energy. They don't depend on glycogen and they don't depend upon glucose. And flooding our system with glucose is only going to turn that into fat. Okay, ladies and gentlemen, this is a very quick synopsis of some of the basic concepts of staying healthy with your heart. And I hope this has helped you, and I will see you in the next presentation. Thank you.